Welcome to KGK Science's Market Watch webinar, looking at the probiotic industry trends and claims over the past 5 years. My name is Dr. Corey Helmus. I was a principal investigator doing preclinical research, an FDA regulator in dietary supplements, and I now oversee KGK's regulatory business unit, providing services for a wide variety of regulatory needs and activities. We do everything from serious adverse event reporting for the US and Canada to NDIs, GRAS conclusions, citizen petitions, you name it. We provide customized solutions for our customers. Let's jump into probiotics and look globally at the numbers and then focus on the US market. Consumers are quickly adopting supplements to maintain their well-being in an effort to keep their healthcare costs down. There is market segmentation, not only based upon product type, but also geographic segmentation. There are about 5 countries that combine for over 3/4 of the share of global retail sales of probiotics, namely the US, Italy, Russia, Japan, and Taiwan. Scientific evidence to support claims, new strain development, safety for regulatory agencies in those countries, and new delivery forms are all expected to contribute to the global growth of probiotic sales over the next 5 years. Asia is the #1 market for the overall global probiotic market, followed by Europe, and US is in third. You could say the US has been playing catch up for some time, but the probiotic supplement market is still strong in the United States. Probiotic supplements represented $3.8 billion globally 5 years ago. Global supplement sales were $88 billion in the global market during that same time period, which represented an overall 8% growth increase from the previous year. Time will tell if probiotic sales hit the 37% expected 5-year growth rate by the end of 2020. Currently, global sales for probiotic foods, such as yogurt and sour milks, which is $41 billion, far outweighs that of probiotic supplements. However, that consumption gap is projected to narrow in many parts of the world, especially as some markets are loosening up their regulatory restrictions on probiotic supplements. Growth of probiotic supplements is strongest in the US. Retail probiotic supplement sales in the Americas was half of that globally. North America is the world's most progressive market, with probiotic supplement sales totaling a 30% share of the overall probiotic market. In Latin America, retail probiotic sales are still strong, but it is mostly tied up as probiotic yogurt sales, which represents 96% of the market. In Latin America, only $150 million is related to probiotic supplements because they are recommended by doctors for certain medical conditions as an antibiotic treatment or for gastrointestinal problems. There are regulatory barriers in Latin America to supplements, as there are in other markets outside North America. What is trending in Western Europe? The retail share of probiotic supplements are growing in relation to the sale of probiotic foods. In Eastern Europe, probiotics suffered a regulatory backlash, but use by consumers and recommendations from influencers are expected to keep retail sales of probiotic supplements strong there. Supplements are predicted to grow at a much faster rate of over 20% compared to probiotic foods in Eastern Europe. In the Middle East and Africa, probiotic supplements are anticipated to grow at the fastest rate over the next 5 years at 126%, but that is due to their small share of the market. Asia Pacific has emerged as a market leader in probiotic sales, driven by new technology, media coverage, and consumer demand from a rise in an aging population. In Asian Pacific countries like Japan, China, and India, and some countries in Central and Southeast Asia, there is strong demand for live microbials and foods like probiotic drinks. Probiotic supplements in Asia are more closely defined as medicinal products with regulatory restrictions like prescription drugs that prevent their purchase in the typical retail channels. Those barriers to entry will continue to prevent strong growth in Asia. Australia and New Zealand are more progressive markets for supplements in general, and have shown decent growth. In terms of market drivers for probiotics, there are many factors. New research is probably the most important, as consumers and the influencers of consumers are looking for the science behind the claims. We also have market barriers or restraints that keep regions from growth. Outside the US, that could be due to the fact that supplements are more closely tied to medicinals, like in Latin America, or even China, which may require expensive blue hat for entry. In the US, it could be that the strain has never been marketed before prior to October 15, 1994, and is therefore considered a new dietary ingredient requiring notification or may require a GRAS conclusion. Novel ingredients to the market will be a major driver, along with the safety data behind them and the data supporting their efficacy. A large one here is what I call claim jumping. Claim jumping is not an industry term. That is a Dr. Helmuth term I coined for it. That is when someone has efficacy data behind the claim and someone else tries to use that published data in the similar claims to support the sale of a different strain of the same species, or it could be a different species altogether. It has huge implications on market dynamics. We talked already about segmentation by geography, but there is also segmentation of product type, which I have also touched on. The key drivers of probiotic innovation comprise four main pillars. They include the new emerging science being developed. Second, consumers are looking for new strains with data. Along with that is ensuring that the new strains are safe when introduced into the marketplace. As I will show later, safety is number one on the top 10 purchase drivers of probiotics for consumers. So investment into the safety of the strain is very important, either NDI or GRAS. This also includes R&D on strains with improved survivability in the gut and greater rates of colonization and targeted action. The delivery form is an important consideration. Consumers are looking to supplement their diet with probiotics using convenient delivery forms. Consumers are also becoming increasingly aware of the benefits of strains as reported in manuscripts, the names of strains, their safety, and the efficacy data behind the claims. There are just over 50 million probiotic users in the US alone. That accounts for about 20% of the US adult population. However, increasingly there are now probiotics directed towards children and infant populations, so we will see that overall number rise over the next few years. From 2007 to 2019, probiotic users increased by over 60%, and millennial probiotic users doubled from 22 to 40% to 41% among males, and grew to a whopping 59% among females. Women use probiotics more than men across all age categories, but that gender gap has been closing over the past 5 years. Technology has changed the landscape, making science more important than ever. 20 years ago, finding information about a bacterial strain was something you could only accomplish from your affiliation at your university library. Databases are at everyone's fingertips. If you have an Android or iPhone, they have access to PubMed, they research articles, they've been taught how to research efficacy and safety. There's been a major shift in our culture today. We believe less about what we read in advertisements, and we're taught to question everything. Consumers of media or products are fact-checking everything and not taking statements at face value. This again stresses the need to have substantiation for claims made on products. What are the search trends hitting home with customers? What does it mean for companies? Demonstrating efficacy and safety for one strain is critical to convince consumers and the influencers. How about global health scares like COVID? How has that impacted probiotic use? According to Business Insights, large and small probiotic manufacturers as well as retailers have reported a surge in the demand for dietary supplements and functional foods in recent months to maintain their health and boost their immune system. In 2020, gut flora seemed to be losing steam, with usage dropping 22% over the past 2 years. Consumers are now looking for specific bacterial species, representing an uptick of 121% in search terms. Colic, IBS, and constipation remain highly searched terms. Immunity in probiotics has skyrocketed, not surprisingly, over the past year by an increase in 74%. 41% of US probiotic users are likely to have a higher education. This stresses the need to know who the customers are and the need for substantiation and safety. They are savvy, educated consumers. They understand conclusions presented in abstracts online. They don't need to be spoon-fed summaries from marketing ads. They are trained to hunt for information from the primary literature source. When you look at the top 10 purchase drivers of probiotics, as I said before, number one on the list to me is not a surprise. It's safety. It's also FDA's number one concern as well about probiotics, safety at the strain level. So the importance being placed on safety has huge implications when introducing new strains into the marketplace. It will require an NDI or GRAS, and therefore one has to think about the preclinicals required to demonstrate safety. The preclinical design is also critical for the intended target population of the probiotic, whether it's adult, elderly, or children. Substantiation behind the claim is FTC's jurisdiction, and that is right behind safety as the most important purchase driver. Investing in clinicals to support statements made in marketing materials is critical to the purchasing habits of probiotic consumers. Certification seals and certification programs are also important to probiotic consumers, as is the source of ingredients. Today's probiotic consumers are increasingly being driven by the younger generation, and they are looking for convenience. They see the need to incorporate live microbials into their diet. While yogurt has dominated the conventional food scene, and probiotic beverages are dominating in Asia, there's a trend toward other foods as well, like probiotics in granola bars, plant protein powders, and ice cream. In response to consumers having a comfort level in live microbials improving gut functionality and boosting immunity, the survivability of manufacturing processes, shelf life in the various food forms, survivability of stomach acids and bile acids is also a huge consideration for companies to make. And this year, there seems to be more of an uptick in academia and media being critical of probiotics and whether there is adequate substantiation for products. This has fueled the need to refocus attention and dollars spent on efficacy and safety. Just like dietary supplements, vitamins, and minerals, there is an age wave for probiotics. Baby boomers have been driving the age wave in supplements for the past 2 decades. All age groups have shown an interest and placed importance on self-directed healthcare. Consumers have shown a strong interest in healthy aging and how to go about achieving it. Supplement use is around 77% total among millennials, Gen X, and baby boomers. Millennials are starting to mirror baby boomers in using supplements. When you look at probiotics, all groups do share a greater awareness of probiotics and their benefits. About 20% of consumers in general report they do not feel they're getting enough probiotics in their diets. But Gen Xers and baby boomers in particular have statistically shown the greatest desire for having probiotics incorporated into their diets. This figure looks at claims and new buckets or categories that marketers are going after. In this figure, I am comparing the claims made as a percent of the total probiotic supplement launches. I've normalized the data from 2015, collected from claims on new probiotic supplement launches. I compared them to claims normalized out of 100 for the time period 2016 through 2020, obtained from FDA structure function claim notifications. So the 2015 data was collected a little differently than the 2016 through 2020 data, which used 30-day structure function notifications required to be filed when going to market with new claims, but the data was surprisingly consistent. When you look at this figure, you might say, well, there wasn't much difference between the snapshot of marketing claims in 2015 compared to the time period of probiotic claims made between 2016 and 19. Digestive health is number 1, followed by immunity at number 2, but there really has been an uptick in 2 major areas. That is probiotics directed at women's health and those intended for use in children. Those 2 areas have doubled in terms of the focused attention they receive by marketers today compared to 5 years ago. There were other growth opportunities in the energy and stamina areas, weight management claims, bone health, heart health, and brain mood health areas. This figure shows the trends in specifically making pediatric claims on probiotics, and it really parallels, for the most part, adult claims for probiotics, and that digestive health and immune health are still number 1 and 2 in children's probiotics, but it also highlights respiratory health, colic, ENT, oral, ENT, eye and ear, nose, throat, oral and eye health in children. There are some other claim categories currently trending in 2019 and 2020 for adults. These probiotic claim categories were taken from FDA's 30-day structure function notification docket, protection for the urogenital system, oral and respiratory health, sleep, endocrine support, ocular health, again, ear, nose, throat health, and even blood sugar control and healthy aging were minor claim areas that have emerged over the past couple of years. Marketing is the key component to the retail growth of probiotic supplements, and understanding who influences probiotic purchases is critical for any marketing initiative. So you may ask, who are the influencers? Physicians and other healthcare practitioners are number 1, followed by pharmacists, who are also key drivers of sales. Healthcare practitioners must be made more aware of the benefits of probiotics in all therapeutic areas. There are ways you can do that. One is through trade associations, where the association engages physician groups on your behalf. It's very effective. And it's very important for companies to become members of a trade association. Another is through educating physicians, nurses, and pharmacists directly at hospitals. I've seen this done at grand round lectures where one presents efficacy data and fields questions from the audience. The only trick is that it can't be a marketing piece. P&T committee members are typically in attendance. That means pharmacy and therapeutic committee members. And it is those P&T committee members that have been charged with determining which probiotic to place on their hospital formulary. Online health advice and social media are huge awareness generators in today's world as consumers engage with industry and brand experts. The other factors are packaging labels, certifications, and other collateral material. In 2019, there was an excellent online cross-sectional survey sent to dietitians, pediatricians, and general practitioners. Paper copies of the survey were also circulated at medical congress meetings, and the survey looked at the attitudes of healthcare practitioners and understanding of the use of probiotics in patient care. In that survey, more than half of U.S. probiotic users wished their doctor provided suggestions on prevention of health issues rather than just treatments. 85% of GI docs discussed probiotics with their patient, but in most cases did not have specific recommendations in terms of the brand, strength, or frequency of use. Consumers' beliefs in the benefits of probiotics are influenced by information they receive from healthcare professionals. Healthcare professionals need to be aware of the current evidence in order to advise consumers, and companies must have substantiation behind the claims made for their products. So it's a two-way street. Over 80% of respondents in that survey agreed probiotics have a place in clinical medicine, and over 70% were likely to recommend them. As a physician myself, that high percent does not surprise me. Inadequate knowledge, in other words, not enough clinical evidence, was a limiting factor for patients receiving appropriate recommendations on brand, species and strain, dose, etc. There is really a need to provide clinicians with more data. Over 90% of healthcare practitioner respondents cited a need for more education and substantiation data. The take-home message here of the survey was that healthcare practitioners would recommend certain probiotics and even brands to their patients if they had more information to support informed decision-making in the setting of patient care. So why is there this apparent dichotomy or dilemma facing physicians? On one hand, they're in the media stating probiotics are not substantiated, and on the other hand, they are members of P&T, pharmacy and therapeutic committees, and they're actively including probiotics as a standard of care in hospitals. You can't even be on a hospital formulary unless you have evidence supporting and substantiating the need. All hospitals have P&T committees which determine what will be kept on the hospital formulary. Physicians and pharmacists know well that probiotics are an accepted standard of care in hospitals and therefore prescribed inpatient and outpatient. The answer is that they just don't seem to have enough information, enough substantiation evidence on all the various strains. They also feel that not all strains were born equally. Demonstration of the efficacy in one strain does not equate to the same efficacy for another strain. This is also FDA's approach of efficacy and safety, which is based upon the strain. Finally, how can one influence the influencers? Well, on the positive side, there is a large opportunity to engage them and especially educate the healthcare practitioners. There was a huge shift in the late 80s and 90s to evidence-based medicine in medical schools. They can only be swayed by presenting them with quality studies on the benefits of probiotics. There are also opportunities to get in front of healthcare practitioners. One could do so directly at major teaching center hospitals to discuss efficacy studies at grand rounds and engage their P&T committee members about the evidence behind specific strains. And others to approach companies like Cardinal Health and other similar companies providing clinically proven products to hospitals, engaging in trade associations like the IPA or Natural Products Association, as well as groups aimed at quality and led by retailers like the Supplement Safety and Compliance Initiative. These organizations can open the dialogue with physician groups and colleges, associations representing physicians, as well as P&T committees. It all reinforces the necessity for investing in clinical trials to support claims and preclinicals to support safety at the strain level. Thank you for attending today's webinar, and a big thank you to our entire team at KGK Science in London, Ontario. Thank you.